Well, come down to Peel and the Wellbeing Centre. Angela Murray here from Health and
Health and Social
Care. Let's get it absolutely right. This is the brand new model of what's going to be rolled out around the island, a Wellbeing Centre. So explain what that is.
Okay. Essentially, going forward, what the service will deliver is an integrated service. So that means that where before you would have had a lot of services working in silos, you're now actually working in localities. So this is the locality for the west of the island. This is the hub for that locality. But that doesn't mean all the services are delivered in here. The services are delivered out in the community. There are some services here, but they're delivered out in the community. And all the professionals, again, instead of working in silos as district nurses over here, community psychiatric services, etc., they all work as a team, in a team way. So any referral that comes into the service in the west of the island now comes in through a single point of entry.
Right.
Okay, one referral into the team. When it gets into the team then work out who needs to be involved. So
this sounds so obvious. It's almost amazing. It's never been done before. So before there was different people getting in. Someone comes out of hospital and different people come along and assess and do their own written reports. This way, I believe everyone meets here. They have a case study and they
do.
Right.
They do. It does seem obvious, doesn't it? But traditionally, health and social care services have been separate, haven't they? So the first part was actually bringing the department together as a health and social care. Then we had services which were divided into silos. So that was like mental health services. Then you had adult social care and all the services under there. Then you had the hospital. Now all of these now come under one service provision. I'm the Chief Operating Officer for that, and it's been de-siloed in the way that all the leadership team, all the heads of service, all work in a leadership team now. So they're not individually managing their areas without actually working with people in a team way.
So I'm guessing from the patient's point of view, things should be a bit quicker, would it be? Because people can get that prognosis right quickly by having all the people in the room to make those decisions.
It's about actually getting the right service. Okay, so the fact that it comes through a single point of entry, any referral from GP or other professional, wherever comes through a single point of entry, it means you get the right service. That will initially speed things up. The point is, we ran this for a year as a pilot here because it's not been done before, and we wanted to see what the sort of workflows would be, what the patterns, in order to then inform how we actually develop the service going forward. Just in a simple way with workforce planning, we need to know whether the pressure is going to be on district nurses or whether actually our statutory services are delivering services that should be delivered by the third sector, for example. So what we found is there's a lot of crossover. So you will get some part of a service delivered by the statutory services, some by third sector. Now, if you go to a tiered model of service, what you would look for is that the third sector provide a base of services at the right level and free up the time of the statutory services. So, for example, a nurse might be involved in something that a third sector provider could do. Then you free up the nurse's time because the third sector underpins everything that we do, which is why we have third sector partners here in a very serious way.
Well, the Chief Minister, who was here making speeches along with yourself and others, he said this came from his, he saw it working in Christchurch, wasn't it, in New Zealand, when he had that famous trip there.
He did.
So this is one of the things that has come out of it eventually.
Yes, when he came back, I think that we'd had the discussion around integrating
care. It's a long time ago, isn't it?
It does. Well, it takes a long time, doesn't it, to actually do the research. Some of us that have come here I did live on the island for a long time, went back and came back, and while I was in the UK worked on quite a lot of integrated care projects. Minister went out to New Zealand, saw the Canterbury model, which is a famous model. Yeah. They also came over here to talk to us about it. That must be, 3 years ago? It must be 3-4 years ago.
Now, yeah.
He is Chief Minister now.
That long.
And then obviously, the work starts with literally on the drawing board as to how you actually do that on an island of this size, which causes its own complications.
Well, finally, when will this be rolled out around the island? Because you've proved this now works. You've had your time, so this will now become a model elsewhere.
Yes, we've already started to work in the south of the island, so that's the next locality. But that it will be quicker to do there, simply because we've tested everything here. We've, just the amount of work that just goes into testing protocols and ways of working and community engagement and all of those things. So the engagement's already started in the south of the island. That's the next locality.